Health Centre IVs are part of a decentralized healthcare system with the national and district levels in the country. These centers are mini hospitals with wards for men, women and children and have the capacity to admit patients. They also have 2 doctors, one of whom is a senior medical officer, as well as an operating theatre for emergency operations. To further enhance service delivery, the government of Uganda, through the Ministry of Public Service, approved a new staffing structure to be implemented by local governments nationwide. This was intended to reduce the health worker to patient ratio by significantly increasing staff numbers. However, complaints persist in the community about the long waiting period at some of the centers, including Mpumude Health Centre 4 in Jinja City.
Nseera bukeere saawa 2 gindagaanayo kati okutukola kuba atandika saawa eyo 6 awo twamaliriza nga tuviireyo 10 twabakaire era anooni abatakeire ndowooza 12 ebyokulya nisabe n'abajjana byo batogiire nabyo era olina kuvaayo bube bakuwa amakerenda walamirako olindala omuntu mubonabona gwe n'esiimiza kuuku n'owa delivery nagenda twagenda saawa zaali emu twalandiko tukolako wa saawa zaali 3 bwezityo 12, 11, 10 saawa webateera webakumalirirawo ofulumira kuba bali siro kutomo webakera saa 5 nabanga bavudde kuba ezo abantu bava ewaka tebalina byebalidde bagenza alina olusadde 10 embeera y'ensi eno nga bwe yatuuka obulumi buli mu ddwaliro ya gavumenti eyo naggulu nago bwe gatyo tetujagalya mpumudde byokka.
NSTV visited the facility to assess the situation. When we visited, we found out that the complaints are valid. Patients wait for long hours, including expectant mothers. In our interaction with one of the midwives, Mary Nakuba, a senior nurse at the health center, she attributed the long queues to the issue of handling first-time mothers, who are known as primigravida.
Yeah, our biggest customers are the younger women. Those ones that are 24 years below. They are young, some of them are experiencing pregnancy for the first time. Then others have issues to share with me. Like if a mother is a younger mother, make sure that you separate them from the elder women.
She says sometimes they are overwhelmed by the increasing number of patients.
As you found me here, I'm alone, but I'm supposed to do family planning, I'm supposed to do antenatal, I'm supposed to conduct deliveries, I'm supposed to screen for the high risks that I can send to the doctor. So when you carry out antenatal, it is not automatic that your mother comes, you only speak and she goes.
It is worth noting that the approved structure introduced new guidelines which required hospitals to employ approximately 343 staff members, up from 133, while Health Centre IVs were equipped to employ 133 workers compared to the previous 56. Despite these plans, patients wait for too long. What then causes this?
All I'm saying, It is true that there is no health unit that is even staffed at 80%. So there is nothing we can really do. People try, and attending to patients is not like, stamping like when you go for a pass, and each one has his own problem. So actually, what they told you is the correct reason, that the staff will have not enough.
According to Mr. Edward Lwanga, Town Clerk, Jinja City, the primary obstacle is the limited budget for wages, which makes it difficult to cover salaries and allowances of additional employees.
The point is wage. Simple. There is no wage for staff. If we wanted if we could get all what we want, the government requires a lot of money. But it's not there. They enhanced the salaries of science so that they can really work, and they are trying their best. But however much the point is for them to stay there for some time. Two is to have a courteous approach to the patients, and the government has done that. But now, making sure that we recruit all the staff that are required, it really requires a lot of money. I'm in government, and we are in government. We realize the government doesn't have all that money.
However, when we spoke to the city health officer, Dr. Isaria Frederick Daniel, he said recruitments are underway.
Yes, even if I urging what I'm saying, the very sick, this one is, the child is convulsing, straight goes to the doctor's room without waiting. So I don't think this situation is alarming. We can manage. And we recently had some recruitment of nurses and midwives. We are going to be deploying. And the Mpumu is one of the facilities which will receive some additional staff.
The Minister of Health says the new structure was approved in the financial year 2023-2024, but its implementation is pending due to delays from Parliament and the Minister of Finance in approving wages.
We hope that the new structure that is yet to be financed will be able to enhance the capacity of these facilities to serve the huge numbers, because the population numbers have grown, but the structures were still operating with few staff. So sometimes it is visible that some health facilities at sometimes will be overwhelmed because of the health worker to patient ratio. But now that will be solved once the Ministry of Finance and Parliament, once Parliament through the Ministry of Finance appropriates the wage that will be able to operationalize the revised structures both at Health Centre 4 and Health Centre 3. We expect an increase on health workers. Like Health Centre 3 will have even a medical doctor, which has not been the case because these ones have been manned by largely clinical officers. Health Centre 4 will have also a number of doctors because the Health Centre 4s we expect them also to perform things like cesarean section and other surgeries. So we hope that once resources are made available, these facilities will be able to offer services at their capacity.
In the meantime, health workers have been urged to create a favorable patient-health worker relationship as they await implementation of the new structure.
The patients charter and the health workers charter that spells out the responsibilities, rights for a patient and for those of the health workers. So as a patient, you need to be briefed, you need to be treated, and you need to accept to be treated. Those are your rights. The health worker also has to be at the health facility as per the public service standing orders, and health workers work 24 hours but those ones who are supposed to be on duty must be on duty. So we are still seeing some challenge of absenteeism at some of our facilities, or even some going on leave without permission or study leave without permission. So it is up to the in charge, the DHO, to ensure that all health workers are on duty as per their duty roster.
In the financial year 2025-2026, Parliament approved 72 trillion Uganda shillings for the national budget. However, the question remains, how much will be allocated to the health sector? How much longer will the patients wait? Until the government approves the wage that will facilitate health workers to enable them deal with the understaffing, medical personnel will continue to be overwhelmed and patients will wait longer. Nagujja Serena, NSTV.